Concern is the rising number of COVID-19 cases in nursing homes and other senior care facilities. In fact, we've learned that almost half of the state's virus-related deaths are people who either live or work there.
Yeah, but Oregon health leaders are reluctant to release much information about where it's all happening. Lisa Balick, looking into this, joins us live from downtown Portland. Lisa?
Well, the need to know, obviously, is for all the people who have been in contact with the thousands of people who work at those facilities, and they may have been exposed to the virus.
So the real question is, how prepared are we for dealing with this when it does get there? And sadly, the answer to that question was we weren't.
Emergency room doctor and Multnomah County Commissioner Sharon Myron wants transparency and assertive action now to prevent more COVID deaths and illnesses among residents and workers at long-term care facilities. The state says it's a matter of privacy. That's preventing them from releasing more information about where there are cases in assisted living and long-term care sites. Some facilities are releasing the information themselves. Over the weekend, the state did finally start releasing a partial report, but only those places with 5 or more cases. Healthcare at Foster Creek in Portland with 35 cases and 9 deaths as of Friday. Laurelhurst Village in Portland with more than 24 staff and residents sick with a virus and 3 deaths. There's also the Vets Home in Lebanon with 34 cases and at least 3 deaths. The state says it's a privacy issue, but Dr. Myron disagrees and says we need to know where the virus is to prevent its spread.
You know, just the basic data that would be needed to track transmission and contacts and fatalities, so we could really approach the issue and provide the treatment and management and care that's needed.
There are actually hundreds of nursing and assisted living facilities in Oregon. The state acknowledges there are dozens of other care homes where there are virus cases. State health leaders have admitted that many county health departments are overwhelmed by the number of cases and can't keep up with tracking contacts of infected people, known as contact tracing. Now, I reached out to the state, both the Oregon Health Authority and the Department of Human Services this morning. I still have not heard back. Meanwhile, Dr. Myron says, look, we need to be in mind that we're going to have a surge of cases perhaps coming up at these facilities, to be prepared for workers to be able to step in. She also says that since we have test kits, a lot of those test kits should be made available to have more aggressive testing for healthcare workers as well as residents of these long-term care facilities. Live in downtown Portland, Lisa Balick, KOIN 6 News.
And I know you keep asking them questions about the transparency here, Lisa. Thank you.